Welcome back, aspiring medical coders. All right, let's just dive right into this explainer, shall we? This is part 3 of our massive 100-part CPC exam series. And today, we're really putting our minimal memorization method to work. Because honestly, instead of rote memorizing thousands of complex medical terms, we're going to learn the predictable, repeatable building blocks that literally make up the language of healthcare. It's like a giant puzzle, and we're handing you the corner pieces. Make sure to like, share, and subscribe to Decode Healthcare with Harshal. Now today, we are unlocking an absolute high-yield topic for the exam: positional prefixes, negative prefixes, and clinical suffixes. Master these little pieces, and I promise you, you'll be able to decode complex clinical terminology in seconds.
Okay, so let's kick things off with positional prefixes. You can kind of think of these as your clinical adjectives. Basically, they tell you exactly where something is happening anatomically. So indo and intra both mean within or inside, right? Just picture intravascular as something traveling deep within the blood vessel. Now move up to the surface and you have epi, meaning upon or above, kind of like your epidermis. And finally, we dive down with sub, which means under or below. Think of a subcutaneous injection going right beneath the skin.
Moving right along to directional prefixes. Honestly, visualizing these spatial cues is a massive time saver for coding accuracy. So if an incision is inter, it's wedged right between structures, like your intercostal ribs. Now if it's trans, it cuts entirely across or through something, such as a transdermal patch. Para sits right beside or near, like the parathyroid gland, which just hugs the thyroid. And retro kind of hides behind or backward, as in the retroperitoneal space. If you just picture the map of the body, these prefixes literally become your GPS coordinates. Section 1. Navigating negative prefixes. Absence or opposition. Spotting these negative prefixes is basically your ultimate cheat code for quickly identifying missing functions or, reasons not to do something. So a or an means without or lack of. Think of apnea, meaning a patient has actually stopped breathing. Anti means against, like an antibiotic fighting off bacteria. And contra means opposed or opposite. Actually, you'll constantly see the word contraindications in your documentation. These are the exact reasons you should absolutely not use a certain treatment. Missing them? Yeah, that could lead to a really disastrous coding error.
Section 2. Disease and condition suffixes. Clinical categories.
Okay, so the suffix is pretty much the grand finale of a medical word. It tells you exactly what is going wrong with the patient. So itis screams inflammation. Osis points to an abnormal condition. Pathy refers broadly to a disease process. Now, if the issue is in the blood, you'll see emia. If an organ is dangerously enlarged, like hepatomegaly, you'll spot megaly. And seal warns you of a hernia or a protrusion. The cool thing is, if you lock these endings to a root word, you instantly decode the diagnosis. No heavy memorization required.
Hold on, it is time for a critical CPC confusion alert. A major trap for coders is over-interpreting osis. Please do not mistakenly assume that osis always means there's an active infection. It simply indicates an abnormal condition, which, is very often degenerative or structural, like osteoporosis. Mixing this up on the exam will literally lead you to the completely wrong diagnosis chapter, so watch out for that.
Section 3. Procedure and intervention suffixes. Surgical actions. So these procedure suffixes are your absolute key to selecting the right CPT surgical category. Listen to this. If a surgeon takes it out, it's an ectomy, or removal. If they just cut into it, it's an otomy, or incision. But what if they're creating a brand new opening? Well, that's an ostomy. Now, if they use a needle to puncture and drain fluid, you're looking at a synthesis. Looking around with a camera, that's a scopy. Reconstructing or repairing tissue is a plasty, and simply suturing things up is RAFI. Every single one of these endings connects directly to the core physical action described in the operative note. Okay, we need another critical CPC confusion alert right here. Mixing up otomy and ostomy is a classic exam trap, and it will absolutely ruin your coding accuracy. An otomy simply means cutting into a patient for access or exploration, right? But an ostomy means creating a permanent opening, like a stoma, for diversion or drainage. So bottom line, do not confuse a temporary incision with a permanent diversion. And here is our final major trap of the day. Both plasty and RAFI refer to a repair, but plasty implies actively reconstructing or reshaping complex tissue, whereas RAFI emphasizes simply sewing it closed with sutures.
They require vastly different CPT codes, and honestly, they pay very different reimbursement rates depending on the exact work the surgeon performed. So you've really got to get these right.
To bring it all together, here's a quick visual summary for today. I highly encourage you to just go ahead and screenshot this slide right now for your study notes. Seriously, do it. This one-page cheat sheet is going to help you lock in these high-yield prefixes and suffixes, so you can decode on the fly.
So, the crucial point we've learned today is you really don't need to memorize the entire medical dictionary, you just need to learn the patterns. Great job today, everyone. Coming up in Part 4, we'll tackle symptom suffixes, field endings, and the incredibly important organ and system word roots. But before you go, I want to leave you with this. How much faster could you code tomorrow if you stopped guessing and started actually decoding the very language of healthcare? Think about it. Keep studying smart, and I'll see you in the next explainer.